Have you ever been to an emergency department in Australia and wondered why is it taking so long? In Australia, waiting in the ED has almost become a part of the healthcare experience. Some waited for hours, even half a day, just to be seen by a doctor. In 2024, data from Australian Institute of Health and Welfare show that over one-third of the patients in New South Wales waited longer than the recommended time for emergency treatment. So what is actually going on with our hospital? For most of us, the ED is the last place we want to be, because it's stressful, unpredictable, and full of people in pain. Last October, a young woman ended up in the emergency room in Sydney after falling ill with an acute gastroenteritis.
大概是4个小时，然后跟那个医生交谈。急诊室里面的人太多了，大家都是人挨人。就在这个等待这个4个小时的时间里面，我就跑了很几次厕所，然后体温还一直在升高。然后因为加上我当时的情绪也非常的差，所以说我就感觉氛围是非常的压抑的。
When she was finally seen by the doctor, she was told that the consultation fee is over $300, or she could pay a visit to GP instead. Her story isn't unique. For many, waiting in pain for hours feels like a second illness, one that created by the healthcare system itself. To better understand what happens behind the hospital doors, I interviewed a former nurse who used to work in a Sydney ED, and she explains that many people misunderstand what happens in the ED. It's not just about waiting in line, but a race to save lives.
Australian EDs use a standardized 5-tier triage system based on how urgent each patient's condition is. The first category is immediate, life-threatening conditions that need treatment within 2 minutes, like cardiac arrest, severe trauma. In Category 5 patients should be seen within 2 hours. They are with non-urgent problems like small cuts or minor rashes.
In the busy emergency department, every critical case is reprioritized. For those lower priority patients, this could mean waiting all night. However, the biggest reason for long waits isn't triage, it's the lack of staff and beds to meet the demand.
We simply don't have enough nurses and doctors on the floor to meet the patient demand. It's a resource allocation problem. We have limited staff, limited beds, and an overwhelming number of patients. Lower acuity patients inevitably wait longer because our limited resources must prioritize to more urgent, life-threatening cases. It creates a bottleneck effect throughout the entire system.
She also said that every shift was like running a marathon. Every nurse had to take care of 4 or 5 patients at the same time, and they barely have time to drink or go to the bathroom.
After my shift, I would go straight to sleep because I had absolutely no energy left. I feel quite anxious and constantly worried about missing something important or not being fast enough, and I think that's quite common in ED staff.
Just like Joyce had mentioned, Australia is facing a severe shortage of emergency medicine specialists. According to a report from Australian College of Emergency Medicine, 47% of the EDs reported EM specialist vacancy in major cities and 78% in regional and remote areas. Meanwhile, 12% of the EDs employed locum EM specialists in major cities and 51% in regional and remote areas. I tried contacting the media department of the New South Wales Ministry of Health, but unfortunately, they refused to provide consultation on this issue. However, I learned from an interview with Dr. Claire Skinner that she also expressed her concern about Australia's healthcare system.
What we're also seeing is a critical shortage of nurses across the system. And if you think about it, when you present to emergency, the first person you will see is a nurse. And at the moment, even when you pick someone up as a doctor, hours into their hospital wait, you'll find that they haven't even had basic care yet, which is totally unacceptable and very demoralising for people who work in the system because they want to look after people.
Data shows that in 2024, only 55% of emergency visits were completed within 4 hours, compared to 69% in 2019 before the COVID-19 pandemic. This means that Australia's emergency medical system has become more overwhelmed after the pandemic. So, what do we need to change this situation?
We have a Commonwealth state divide around who provides healthcare. We need integration badly. We have a public-private divide with escalating out-of-pocket costs for our patients. What we badly need is one of the major parties to step up and offer to undertake structural health reform.
ED is supposed to be a place of care and safety, but when waiting becomes part of treatment, it means Australia's healthcare system is in crisis. What we need is courage and leadership to rethink the entire system and engage in dialogue with Australian public about the health values and how to implement those values to provide better healthcare. Perhaps this is a starting point for saving Australia's healthcare system from the crisis.